morning, everyone. Good morning, Dr. Deepesh. We are ready whenever you are.
Good morning, Dr. Nainani. Yes, we are ready. Good morning, everyone. Today we are going to do some mat activities, some basic exercises of weight reduction. So I request to all of you to do these exercises in sequence. So we will start all these exercises with the help of medicine ball and with the help of pillow. Now we will check the spasticity or the stiffness in our body with the basic movement from neck to back. First, we will start with the neck, then we will move to mid back, shoulders, lower back, and SI joint, which is sacroiliac joint. Now we have to check the range of motion, which side is more restricted. So first, we have to assess that this side is more restricted. We have to give more focus on more restricted side. So first of all, we'll check basic range of motion of all the joints by doing basic stretches or by doing basic movements. Why it is necessary to check? Because if we know the spastic or the stiff side, then we can give more focus on that particular side. By giving more focus on that particular side, we can reduce our spasticity or we can reduce our stiffness on that particular side. If there is any pathology or if there is any other deformity on affected side, then it can be treated according to the protocol. So first we will move to check our neck range of motion. I request you all check your range of motion, be in erect posture, and just check your range of motion by stretching, by bending neck on one side and on other side. For example, my left side is more stiff than right. So the right side bending of neck is complete and the left side bending of neck is partial or incomplete. My ear is not touching to my shoulder. It means my left side is more stiff than my right side. So I have to assess, I have to go through this, so by which I will emphasis on the stiffer side. Then I turn my neck on right side. My neck is going right side completely. Left side is partial. It means it is having left side stiffness. After that, shoulder range of motion. Right is complete. Then left is incomplete. Left is not going up. It means I got a basic idea that my left side of body is more stiff. So I have to do these stretches in a ratio of 6:4. 6 on the affected side, 6 stretches on the side where the stiffness is more, and 4 on non-affected side where the stiffness is less. So we have to move like that only. You can see trunk bending on both sides, right side trunk bending and left side trunk bending. Left side is lesser than right side, it means I am having overall stiffness on my left side. Everyone is having left or right, either side of stiffness. So according to that, you have to maintain your protocol in 6:4. The ratio will be 60% exercises or stretches on the affected side, which side is more stiff, and 40% is non-affected side, which side is non-affected or non-stiff side. So first we will move with the basic stretches of neck. After that, we will move to mid-back and the pillow exercises, which are very effective for weight reduction plus core strengthening. First, we'll do neck exercises or side bending exercises. For example, I'm bending my side neck on left, on right, left to the right, left on right, and hold it 10 seconds. You all can do with me. So it would be a complete protocol on a system-based exercise. Left side stretch like this. Yes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And this stretch, we have to give more pressure from our fingers to our head. You don't need to give pressure to your head. You don't need to give pressure to your neck muscle. You just have to give a side bend, a gentle side bend by pressing your fingers on right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then on left side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have to give pressure from our fingers to our side of head or the temporal region like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the first step, first stretch, which we have done with the help of our hand. That is completely manual. Now we will do second, which is isometric, but we will do with the help of pillow. You can use any pillow, big or small, whatever the size is, it doesn't matter. Just need to place it on correct place. By placing it correctly, you can get a proper isometric exercise stretch or proper stretch to that particular muscle. By giving that particular muscle stretch, you can emphasize the strength of that muscle. So I'll turn this and place on my side of head, and the pressure which is going from left to right and giving with my head and ear. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The important thing is that I am giving pressure from my head and neck area, not with my palm. I'm not giving pressure with my palm or hand. I'm just maintaining this with my palm or hand and giving pressure towards this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the side which I have given stretch first. First, I have to complete all the stretches of left side, then on right side, or on either side, alternate we can do. Second is isometric of affected side or non-affected side. We have to start it from anywhere, from right or left. Then left side pressure, I am giving pressure from my head towards the pillow. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the pressure, the basic isometric exercise after the stretch. What design is in our protocol is to give stretch and isometric exercises one by one. So there is a combination of isometric exercise and the stretching exercises to increase strength of your muscle in a faster way. Now we will do forward bend stretch. Forward bend stretch is not indicated for patients who are having vertigo. So be cautious for that. The patient is having vertigo. If someone is having vertigo or head spinniness, so it should get avoided. This particular movement. It's a normal movement, forward neck bending. After the bending, we have to give pressure from our hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm giving pressure downwards. I have given pressure downwards. After the complete stretch of muscle, head down, I have given complete stretch. Now hold and pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was forward neck bending with stretching of lower neck muscles. Now backward movement. In these all movements, we have to give stretch, we have to give pressure after the end of active stretch. That is very, very important to understand that if I am giving stretch to that particular muscle, firstly I have to give a normal stretch. Then after I have to give a passive stretch or a pressure of external side. So first you have to give a gentle stretch, then you have to stretch with your hands. That is the second type of stretch. Now, first was side bend, second was forward bend, and third is backward bend. Stretch is complete. Now give it a hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If your range of motion is less, then also you can do if neck is not going properly forward, so you can just wait till the range get down. After that, you have to give pressure on the affected side. It was the second stretch. That was the third stretch. Now we will do isometric. In isometric stretch, we have to give pressure from against side. So,
sorry, doctor, your video is frozen. Yeah.
My
video is frozen.
My video is frozen now.
And volume, yeah, now it's okay.
And volume is echoing, it's not very clear voice.
Voice is not here. Just a minute. I'll check the settings. Now it's better. Am I audible?
Voice is not very clear.
Voice is still not clear.
Okay, yeah, it's okay. We can see you now. At least you're not frozen.
Yes, and the voice is not clear.
That voice is fine. Yeah, but sometimes it breaks up.
Okay, just a minute. Now we will do further neck movement with isometric movement. In isometric movement, we have to give pressure from against side. From which side you are doing the movement? On the side we are going to stretch. will have to give the pressure against that. So first we have done side bending. For side bending, we were giving stretch on this side, pressure on this side. For this side stretch, we were giving pressure on this side like this. For forward pressure, for forward neck bending, we have to see the proper placement of that pillow. My neck is bending forward. I'm bending my neck forward and giving pressure to that pillow upwards and giving pressure to that pillow from up to down, and my head is upwards like this. So in this, you have to just stabilize this pillow with your hand and give pressure upwards from your head down to up. From your head down to up. And giving pressure, there is no movement. Isometric exercises are having no movement. There is no visible movement. You cannot see the movement. You just have to feel the muscular area contraction. That's it. From down to up. Down to up. And giving pressure and hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What I have done, I have given pressure from my head to this pillow from down to up with 10 seconds hold. Now I'll give pressure from my head down to up, from backward to forward. That is very important step of this exercise. You have to place pillow on your forehead. You have to place pillow on your forehead, because if you place on nose or mouth, then you cannot breathe easily. So it's not possible. So we'll give pressure on our forehead. By giving pressure on our forehead, I'll give movement from backward to upward, backward to forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That would be 6:4. That I am giving stretches on this side is 4, on this side is 6, because this side is more stiff. I'm giving pressure forward 6 because forward bending is more restricted, backward 4 because backward is less restricted. So we have to understand the stiffness of the body of the particular side. Now we will move to our next stretch, which is a shoulder stretch.
Sorry, doctor,
Yes.
before you move to the next stretch, this one we just did with the pillow, I don't really understand what you mean by down to up or back to forwards. What are you referring to?
Yes.
Is it pressure? What is it?
Yes, it's a basic movement of neck. This is our side movement. This is our forward movement. This is our backward movement. Backward is backward movement. So in this exercise, what I'm doing, first I have given stretch to that particular muscle. After giving the stretch, we are doing basic isometric exercises with the help of pillow. So we have to understand that thing very clearly, that first we have to give stretch of that particular muscle. After that, in second step, we have to give pressure with the pillow from our head. So how to do the pressure, I'll explain you one more time so you'll understand more better. First, I have given stretch on this side. Second stretch I have given on this side. That was elongation of muscle, stretching of muscle. After giving the stretching of muscle, we will do basic contraction of muscle. What is isometric exercise? Isometric exercises is type of contraction of muscle. You cannot see the movement, just pressure from muscle towards the pillow. So we will start this from here, and the hand placement is on this side. Hand is only for support. By supporting this, I'm giving pressure from my hand to the pillow, from my head to the pillow, and hold from 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was for the first side. And for the second side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In second step, I have done forward stretch. In forward stretch, I have done stretch. After the normal stretch or the normal range of motion of my neck, I have given a basic stretch with the force 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is forward stretch. And then backward stretch. Backward stretch I have done like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have to give stretch after the normal range of motion of our neck. If the range of motion is this, then after I have to give the stretch opposite side. With the help of both hands or with the one hand, single hand only, you can give the stretch. So after giving that stretch, we have to give isometric stretch, isometric movement to that particular muscle. By giving isometric movement, you can do forward bending, forward bend, and stretch from neck and head towards upside or towards back side. You have to give head pressure like this. You have to stabilize the pillow from your hands and give pressure with the head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It is very important to understand that I am giving pressure with my head towards this pillow. And the movement is invisible. There is no movement, there is just a simple contraction of that muscle. So we have to understand this. After that, last movement was backward movement. In backward movement, I have placed pillow on my forehead like this, and I am giving pressure from my head to this pillow with the 10-second hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the movement. That's a combination of isometric exercise plus stretching exercises of the neck. You have seen so many exercises of the neck like this. This is always a basic exercise of isometrics of neck with the neck movement on sideways, on side bending, plus forward and backward. These were the simple movement. What we have done, we have checked the threshold of that particular muscle. By checking the threshold of particular muscle stiffness, we have maintained a ratio of 6:4, 6 stretches and isometric exercises on the affected side, and 4 stretches on non-affected side once in a day. So this is important for cervical spondylitic patient. Even osteoporotic patient can also do. The patient who are having some radiating pain, the patient who are having stiffness in shoulder due to cervical spondylosis, they can do these type of exercises. But the ratio should get equal with the 6:4 percentage, because by this ratio, you will give more stretch on the affected side and the affected side will release faster. So that was for the cervical. Now we will move to the mid back and shoulder. Why we are using this pillow? Because foam and density change can help in increase the threshold of muscle. If I'm doing exercises with my hand, so contact of the muscle to the other muscle is not that much effective. It is already effective. It is already authentic. I'm not saying this is not authentic, but the density change can give you more relief and can give you more faster strength on that particular muscle. So we have made a basic structure, basic stiffness protocol according to stiffness, and that is 6:4. So that was for the cervical patients. If someone is having vertigo, if someone is having any dizziness, then it is completely contraindicated. Otherwise, they can do all the movement. In vertigo patient, they can do gradually with the vertigo exercises and stretches in a slow way with the ratio of 2:2. If someone is having severe vertigo, then they can do 2:2. After the exercises, the session get completed, they should do basic rest up to 10 to 15 minutes. That is indicated, and that are the guidelines only. So we don't need to worry about giddiness and vertigo. Now we will move to the shoulder. In shoulder girdle, first we will do stretch, then we will give isometric. Again, combination of isometric exercises and the stretching exercises. In shoulder, we will do
Before we
one.
start, please, doctor, please, before we
Yes.
start, can I ask a question, please? But
Sure,
when we did this pillow on our head, we have to press back of I mean, on the end of the head or in the middle of the head?
No, the pressure is from our head only. The hand is only for stabilizing the pillow. I'm not giving pressure from my hand. After the placement, what I have done after the placement, I have done placement. After the placement, I am giving pressure from my head and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again,
No, I'm talking about that when we did head, like this. We did head.
When we
did
head.
When we did the head, that where we have to put pressure in the middle or at the end of the head.
No, we have to give pressure from, we have to give pressure from whole side and not in the middle from starting to end till 10 seconds. It's a 10-second pressure. After the placement, you have placed this, then you have to give the pressure like this.
She wants to know more about the forward bend and the backward bend with the pillow. She's not sure where to put that pressure. You said you have to press the head against the pillow. I think she's a bit confused.
Yes, it is really simple. You just have to give pressure towards the pillow. If the placement of the pillow is like this, then you have to give pressure towards the pillow. If the placement of the pillow is like this, then you have to give pressure from this side. That was, I was trying to explain that the pressure is universal towards the pillow. If the surface of that pillow is contact in this area, then the pressure is also on this area only. So you have to give pressure on the contacted side of your head.
Fine. Thank you.
Shall we move?
Yeah.
Now we have to understand the shoulder movement and shoulder stretches. With the stretches, we will move to the isometric exercises. This is very effective for frozen shoulder patients or the patients who are having cervical spondylitis, radiating pain in arm or in the hand with the tingling sensation. If someone is having frozen shoulder, then they can do these type of exercises very easily and the frozen shoulder get resolved in few sessions. In frozen shoulder, we have to give a basic stretch. Placement is like this. First, we have to understand the placement. If you understand the placement, we can see the placement. If you understand the placement, then it will be more easy for you to understand the type of exercise. The placement of pillow, the placement of exercise, and the direction of the stretch is very, very important. Be more specific on this. Don't get confused. It is really easy. Just go through this video again and again. You will get automatically understand that what is the type of isometric exercises is this. So first we will give a stretch to shoulder muscle. Then after we will give isometric to that shoulder muscle. In the beginning of the shoulder exercises, I would recommend to release your shoulder. In releasing your shoulder, we have to just place our hand like this, thumb behind and fingers in front, thumb behind and fingers in front, and a normal rotation of the shoulder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Against anti-clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. First, we should release our shoulder by this exercise so you can give more fine stretch to that particular muscle. After the giving rotation of that muscle, we will start with the left shoulder. The hand placement will be like this. After the hand placement, I will stretch my shoulder behind. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The important thing is a neck should erected in this movement with the back. I'm not doing like this. My neck is not getting turned. My neck is erect and my shoulder is moving backwards like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. With the right hand, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In frozen shoulder patients, they may get some difficulty in moving backwards. If the range of motion, normally the stretch is up to this only, then it is fine. If the range of motion is up to this, then you have to release your shoulder first with the basic movement. Then you will start doing these stretches. So in frozen shoulder cases, especially in frozen shoulder cases, we will give a gentle pressure on back side. 1, 2, 3, 4, 5, 6, 7. That is the first stretch of shoulder. After the giving normal stretch, we will do isometric exercise of the shoulder compartment. In isometric exercise, the pattern is little bit different, so we have to understand that pattern. This is a range of motion exercise plus pain relieving exercise. In this, we can get some relief in your shoulder by doing this isometric exercise. I'm doing stretch. What I was doing like this, that was the stretch. That was the stretch. And for isometric, the pattern is different. That was the stretch. And for isometric, pattern is different. Isometric, I had to give gentle pressure from my shoulder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It is really hard to understand that where is the movement. There is no movement in isometric exercise. There is only contraction or only one side external force towards the object. So you cannot see the movement. There is no movement in isometric exercises. That is why they are really important for strength exercises. Backward movement, I have placed pillow like this. Place pillow like this. After the placement, I am giving pressure with my shoulder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Imagine this is pillow. Imagine that this is pillow. I am giving pressure for my shoulder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. See this, my hand is stabilized. I'm not moving my hand because this is isometric movement. So in this, you don't need to move your hand.
Can I ask a
Just have
question?
to stabilize. Yes, sure.
So you're telling me you push the pillow against the shoulder, almost as though you're pushing your shoulder forward, and the cushion is pushing it back. Yes.
Yes, I'm pushing from my shoulder towards the pillow. Pillow is always stabilized in all types of exercises. So imagine this is the pillow. My hand is the pillow. Imagine this is the pillow. I'm giving pressure from my shoulder, not from the pillow.
So the pressure of the shoulder is coming forward, yes, towards the pillow.
Yes.
Okay, got you.
Yes, towards the pillow. That is an isometric stretch of the shoulder.
Yeah, I understand.
So just imagine that this is the pillow and the shoulder is moving backwards with this movement. After the completion of this movement, I am giving pressure and placing the pillow and then giving pressure from my shoulder towards the pillow. I am giving pressure from my shoulder towards the pillow. If the placement is this, and the pressure is this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is really important to understand that pillow is for only making barrier. It is not for making pressure, or it is not for putting pressure on that particular area. You have to strengthen your basic joint range of motion. So increasing the joint range of motion, we have to give the pressure from joint only, not from the pillow. In all the movements, the concept is same. So we don't need to get confused in this concept. Again, on this side, the pressure 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These are really miraculous exercises if you do in proper combination of 6, 6 to 4, stretch and isometric. Now we will do the second movement of the shoulder.
Sorry, your
Shoulder.
video is frozen again. Oh, okay, it just came back. Sorry.
You have to give next stretch to the shoulder. Placement is on opposite side. If I'm giving pressure, if I'm giving stress to my left shoulder, then my palm is on my right shoulder like this. By placement, you can see, you can go through the video to check proper placement of hand. After that, stretch, stretch, stretch. Yes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 6, 7, 8, 9, 10. That was simple stretch on right, on left side of the shoulder. After giving the stretch, we will move to isometric stretch or isometric exercise. In isometric exercise, the placement is very important. You can do with the help of a small pillow. This is
Sorry,
the
doctor.
one.
Sorry, doctor. Sorry, doctor. Because your video is freezing up, we can't see the pictures very clearly. So the last exercise you did for the shoulder, you were actually pushing your forearm with the other hand. Were you towards the back?
Yes.
Okay, because it gets frozen. Yeah.
Yes, yes, yes. My hand was on opposite shoulder and then giving pressure from my palm to this. This is a stretch exercise. First, we have to do stretch exercise. Then hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then on opposite side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. On both the sides.
Yes.
6 is to 4. 6 on the more stiffer side, 4 on the less stiffer side. We have to maintain the ratio very, very, very properly, because if someone is having both sides normal, the both side range of motion is normal, and the both side arm and shoulder range of motion is fine, then they have to do 5 to 5. And that ratio is 5 exercises, 5 stretch on the affected side, on non-affected side, 5 on affected or non-affected side, because the both side range of motion is normal. It is not having any directly relation with the pain. If the range of motion is same on the both side and my pain area is this, then also you have to do 5 to 5 ratio exercise. If the range of motion is less or the side is more stiffer, then only you have to do 6 to 4 ratio. Now, in backward stretch, what we have done, we have checked the range of motion. First, we have done this. Next was this. After this complete stretch, we will give isometric with the help of pillow. I'll just place pillow and I'll give pressure with my elbow. Pressure with my elbow, and the movement is invisible. Movement is invisible. I have placed like this, and the pressure 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Was on the left side. On the right side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was on the right side. The basic stretch of shoulder. First, we have done this, then we have done stretch from elbow, isometric exercise towards the pillow. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the combination of cervical and shoulder. If someone is having frozen shoulder with cervical spondylitis, then they have to start exercises with shoulder first, then neck. If someone is having only cervical spondylitis, then they should start with cervical, then shoulder. That is important to understand that where we have to give more focus in these exercises. In next session, we will move to our mid back and side back with the stretch and the isometrics of pillow. In 2 or 3 sessions, we will complete all whole body stretches. The very important and very interesting thing in this that we have to do these all stretches, all movement once in a week only with your regular activity. If you are doing regular exercises of cervical spine, if you are doing regular exercises of shoulder spine, then you should do these exercises once in a week only, because it is to increase your basic strength, basic inner threshold of the muscles. If you are doing 5 times, 6 times exercises in a week, so after that, end of the week on Saturday or on Sunday, you have to do these pillow exercises, these isometric exercises with these basic simple stretching exercises. Then you can ask any question about the concept of these exercises or ratio of those exercises, because the ratio and the concept of pressure is very important to understand. If you understood that pressure and ratio, then you will do these exercises as a miraculous way for relieving the pain, and that is very immediate response giving exercises.
Yes, hello, doctor. Thank you for the information. I have got a few questions. So the first one is, if you have got cervical issues, like, the bones at the top of your neck, I don't know if they're C3, 4, 5 or whatever, you can still do those neck exercises, okay?
Yes.
Yeah?
Yes, you can do still.
Okay, the other question is, when you said do the stretching exercises first and then do the isometric, so do you finish all the stretching first and then do all the isometric, or do you do stretch of the arm, then isometric of the arm, etc.?
Yes. Isometric of the arm first, isometric of that particular muscle is secondary. First, you have to give the stretch. For example, I'm giving side stretch on this side. First, I have to complete all the 6 stretch on that side. Then I have to give on isometric stretch.
Oh, so do
first,
all the stretches first, yeah? The different ones you told us.
First complete stretching exercises, then isometric exercises. These are the combination of exercises. But in zone, what we were doing a zonal exercises. First, you have to complete cervical isometric plus stretching. Then you have to give the basic shoulder stretch and isometrics.
Okay, so that's how we do, yeah? Do the zonal, the neck stretches first, then the isometric, shoulder stretches, and then the isometric for the shoulders, yeah?
Yes,
okay,
isometrics for the...
Yeah, and the last
Yes.
question is this ratio of 6 to 4. So does that mean on the affected side you do it 6 times, on the other side you do it 4 times? Is that what you
Correct.
mean? Huh? Okay, so we
Yes,
only do
correct.
the 6 to 4 or 5 to 5 if there is no pain, yeah? Okay.
If there is no stiffness, then
Yeah.
if there is no stiffness, then we have to do 5 on 5.
Yes, yeah, no, I always have stiffness on my shoulders, neck area, collarbone area, shoulders.
Yes, approximately 90 to 95% patients are having stiffness on one side more.
Yes, I will have to find out, especially when you bend the ear to the shoulder, those side muscles really hurt on the side.
Yes, you can see the side of stiffness on one side.
Yeah, thank you.
Yeah,
Can I ask you another question, please?
Sure, please.
Are these exercises good for tendinitis of the shoulder?
Yes, tendinitis of the shoulder is also, you can start with this stretch first, then this stretch second. In the tendinitis, the tendon get inflamed, the range of motion get restricted. In this range of motion, which is restricted, you can give a gentle stretch. It is not indicated to give more stretch. We will start with the gentle stretch. Always in the case of tendinitis, we do recommend then start with the basic rotation movement on the both sides, then start basic stretch, and then isometric on affected side first, non-affected side second. So if my right side is affected, then I'll give 6 stretches on my right side. If my left side is non-affected, then I have to give 4 stretches on non-affected side. This is really important to understand that with the cervical exercises, you should do shoulder exercises always. And in shoulder exercises, whatever the condition is, tendinosis, tendinitis, rotator cuff tear, you have to do cervical exercises because they both are correlated. So you have to do both the regimes simultaneously.
And where do we find the videos of these repetitions?
It's on YouTube.
Okay.
And you can ask in group also.
Yeah. So doctor, just to clarify.
For tendinitis.
Sorry.
First, let me answer the question because I forgot the question. What was the last one? In the neck movement, in the tendinitis or tendinosis cases, the neck movement on the rotation is not indicated. If we do neck rotation, then the tendon will get stretched on one side more. It's better to do all the stretches in blocks, all the cervical stretches in blocks. If someone is doing all the rotation movement with the affected or non-affected side, it doesn't mean that you'll get your shoulder or neck muscle. It means you are not going to strengthen your muscles. Just have to do forward, backward, sideways, oblique front, and oblique backward. That is the rotation. It is not indicated. This movement clockwise or anti-clockwise is not indicated because the stretch which you will feel on affected side is less, on the stretch on non-affected side is more. So you are going to disbalance your neck more. So in this case, the basic stretches you have to do in blocks: front, side, oblique, oblique, and oblique backwards. Backwards oblique movement. That is completely indicated, and you will see the effect in few sessions. Yes, now you may ask, please.
Thank you. Yeah, sorry. So even half circles are prohibited, not the full circle of the neck, just a semicircle. Is that prohibited?
Yes, semicircle. Yes, semicircle is fine, but you have to see the range of motion and the stiffness side. If this side is stiffer, so in moment this will go like this, and after that this will go like this. So there is a difference between right and left. So it's better to do in blocks: front, back, side, and side obliques and obliques. This is also equivalent to the rotation of the movement, which is clockwise or anti-clockwise.
Oh, I see. Okay,
It's
so that's
completely effective and authentic.
Oh, right.
See, there are some there are some asana in yoga. There are some exercises in yoga which is indicated for cervical spondylitis by giving gentle movement on right on left side. There are so many exercises also that to give the rotation of neck. But sometimes what we do, we give more pressure on non-affected side and we give less pressure on affected side. So this pressure will change your mechanics of your neck. So it is not indicated. If your neck is perfect, you're not having any cervical issues, both sides is perfect, then you can do the rotation on both the sides. But if someone is having basic shoulder problem or basic cervical problem, then uh, they should start with the basic exercises of the neck in forward and backward in a block way.
So basically, if you have got a neck and a shoulder problem, if you've got neck problem, you start with neck first and then shoulder. If you've got a shoulder
Yes.
problem, you start with shoulder first and then neck. Is that right?
Yes. Yes.
Okay. I don't know what tendonitis is, but I know I've got problems with my neck, and my shoulders. So
Yeah, tendinitis is swelling in the tendon or rupture of the tendon of the shoulder area.
oh, okay. I haven't got that. I'm just stiff everywhere, really, and neck is the problem. So, yeah. Okay, thank you. And do you just once a week, you told us? Yeah, okay, thank you.
Any other question?
No, thank you. Thank you very much.
Welcome.
I was
Yes,
just going to add to
thank
the
you.
lady who was talking, go and have it assessed by a GP, have a scan or something, and you'll be advised what you're suffering from, and then you can do these exercises knowing what you've got.
Yeah, no, I have done an MRI scan. It's my spine, the vertebra and the top near the neck are affected and the one near the lower back. So it's the spine. They said it's age-related degeneration. So I have to be careful. And obviously I've got osteoporosis on my hip and my knees as well. So
Okay.
Thank you, everyone. Thank you, Dr. Deepesh. I'll share
Thank
the
you so much.
recording with some of the edits, but then thank you again.